Senator Larson, Representative Scanlon, I know that Senator Kelly would be with us if he could, ranking members, and all the members of the Insurance and Real Estate Committee. Thank you for allowing me to testify on this important bill, number 5208, an act concerning mammograms, breast ultrasounds, and MRI imaging of breasts. I would like to start off my testimony by saying that I support this bill in its entirety, as an alarming 3,500 new cases of breast cancer will be diagnosed again this year in Connecticut. In the early 2000s, Connecticut was the leader in supporting and passing legislation that supported prevention and screening of breast cancer. Sadly, not enough progress has been made since then, and our laws no longer reflect the developments that we've made in healthcare. And as a result, Connecticut now ranks number 2 in the nation for breast cancer incidence. We are number 2 only behind New Hampshire. Other than skin cancer, it is the highest rate of cancer in women in Connecticut. This bill has various components addressing the screening and the prevention of breast cancer. My testimony is going to focus on one particular area, which is the coverage for ultrasounds for persons with dense breast tissue and the need to be covered in the same manner as other screening mechanisms. When it was determined that screenings for women with dense breast tissue could possibly miss small abnormalities because the tissue masks the abnormality, our then Governor Jody Rell championed a bill in Connecticut whereby radiologists need to inform women now that they have dense breast and may need an ultrasound to complete their full screening. This was a significant step of notification, and it was important, but the next step we need to address is how these ultrasounds are covered. When I was first elected and joined the Public Health Committee, one of the first things I did was call all of my doctors, and I asked them what is the most prevalent obstacles that they see for access to care amongst their patients. When I contacted my gynecologist, she said without missing a beat that for all intents and purposes, ultrasounds are considered a necessary tool for screening and prevention in women with dense tissue, yet the many patients who have to meet their deductible first would need to pay out of pocket for this procedure, and therefore it is not covered consistently, and they end up foregoing this screening. In other words, if your deductible is $1,000 and the cost of an ultrasound is approximately $400, which is a national average, the woman won't get the procedure because they would have to pay that $400 out of pocket first before they reach their deductible. We have a lot of inequities in our socioeconomic backgrounds in Connecticut, and this is a perfect example of those with an inability to pay who will not get the access to care that they need and they deserve. Let me just quickly address the cost to the state of Connecticut, as I understand that prior to passing any legislation for all residents of the state of Connecticut, there's always a consideration of what this bill will cost to the state of Connecticut employees. Therefore, I want to make sure I highlight something for you as you go forward in your consideration. If an employee in the state of Connecticut goes in network for an ultrasound for their screening, it is already covered. Only those employees who go out of network for an ultrasound screening, it wouldn't be covered. So the cost will be a lot less significant than you might perceive in covering the ultrasounds. Finally, I want to point out that our neighboring state of New York was yet another state that passed in 2017 a law which generally prohibits health insurers from charging coinsurance or deductibles for mammograms, ultrasounds, or MRIs as long as the insured meets certain criteria and goes to an in-network provider to perform the procedure. This legislation is one for Connecticut to potentially look at as a model in order to ensure the well-being of our residents through equitable insurance guidelines regarding both the coding of mammograms and the application of our deductibles. I want to thank my colleagues who have supported this bill in a bipartisan manner. And while my testimony focused today on the ultrasounds portion of Bill number 5208, I just would be remiss if I did not also lend my support to Bill number 5100. Thank you for your time.